Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Tubular functions, and under the tubular functions, we are looking at the proximal tubule. Proximal tubule. So what is this proximal tubule? It is nothing but a workhorse. The workhorse of the nephron is the proximal tubule. It contains the brush border epithelium, and there is an isoosmotic reabsorption of about 67%, and this is nothing but of the glomerular filtrate, and it occurs here. Next is the site of active reabsorption. It is about 100% glucose. Active reabsorption is of 100% glucose via the sodium glucose co-transporter, and 90%, the 100% glucose via the sodium glucose transporter is the site of reabsorption, and that is 90% takes place in the S1 segment of the proximal tubule by the SGLT2, and also the 100, also the 10%. So SGLT2 as well as the 10% of the S2 and the S3 segments, and this is via the SGLT. It is via the SGLT1, and from the tubular cell. The glucose is transported into the interstitial fluid by the GLUT2. So that is about 100% amino acid is done by the SGLT2 is amino acid. Then about 65% of the sodium is via the NaH exchanger, and the phosphates are also co-transported. And this is with the Na. So about 90%, if you see, it is the HCO3 is reabsorbed. The 90% of HCO3 is reabsorbed through the NaH exchanger. And other substances, what does it include? It can include potassium, which is maximum, and then the galactose, fructose, calcium, uric acid, and also the vitamin C. Now let's look at the passive absorption. Passive absorption of urea takes place, and that is about 45%, and also about 65% of the water through the aquaporin. This is 1. Now the active secretion of organic acids. Example is the pH. Next comes the diuretics, the salicylates, the penicillins as well as the probenecid, and ammonia, which acts as a buffer for secretion of the H+.